I'm Dr. Bowers, and in this video I will be discussing some basics of diagnosing and treating interosseous strains. There's going to be a lot of pictures and descriptions, and I know some of you will be tempted to skip to the how-to parts, but to be able to change function, you have to have a good sense of the relationships of the structures. The human body is not solid. It is a heterogeneous blob of varying densities, a mix of parts, some feeling more or less solid than others. The parts and the whole are in constant motion, and the density of the parts and their arrangement affects how they move and how force moves through them. The density and arrangement within a part can be altered by forces acting on the part, and the resulting derangement lasts until corrective forces overcome it. Most corrections occur spontaneously due to inherent motion, but some persist and require outside intervention in order to re-establish optimal density, arrangement, and motion. Sometimes that means hands-on manipulation, and other times it means surgery, medication, or some other intervention. The body's connective tissues, including bone, have the ability to deform under stress. This is mostly reversible unless the stress is too great or the strain is present long enough during a growth phase. Intraosseous strains are reversible due to the viscoelastic properties of bone. A living bone is not solid like a rock. It is more like a tree that can bend with the breeze. About 35% of bone is a protein organic matrix consisting of collagen and proteoglycans. Up to 25% of bone is water. Much of this water occurs in pore spaces responsible for nutrient diffusion and contributes to the viscoelastic properties of bone. Healthy bone should have some amount of give to it internally because it needs to be able to accommodate stress instead of breaking. Looking at these shells, we can see that some of them have warped due to the forces of gravity, but these shells are dead and dehydrated. Living bones and trees are full of fluids and proteins that give them flexibility and resiliency. Let's take a closer look at living bone. In this diagram, you can see there are many spaces, and they are all filled with substances and sometimes even cells. Here is an electron microscope picture of a transverse cut through compact bone, showing blood vessels within the central canal, surrounded by layers called lamella. The small holes you see are called lacuna. Within the lacuna can be found osteocytes, which build or break down bones based on chemical, mechanical, and electrical signals. Looking at some histology slides, we can get an even better appreciation for the diversity of density and form. Force will move and affect periosteum differently than bone. It will affect trabecula and marrow spaces differently than endosteum and veins. And the epiphyseal discs or plates of a growing bone have a different tensile strength and stability than do adjacent parts. Even once the epiphyseal disc has matured and closed, there is still a variation in composition as evidenced by the epiphyseal lines that can still be seen in adult bone. Interosseous strains often occur within bone where there is a difference in composition, so frequently they are found adjacent to areas where a bone fused together. But an interosseous strain can still occur anywhere within a bone if the right force stresses the bone enough to warp it. Unlike a broken bone or fracture, an interosseous strain is a reversible compression. It will not show up on X-rays or MRIs or CTs as it is occurring at the microscopic levels we were just looking at, while a fracture is an actual breaking of adhesion molecules. An interosseous strain is a distortion or warp in the bone held in place by a dysfunctional tension that was created when the causative force overwhelmed the functional tensions in an area of bone, causing a change in hydrogen bonds and possibly ionic bonds. The initial causative force is usually from an external force applied to the body, like with a fall or crash, but sometimes even the muscles pulling on the bones with sufficient force can cause a strain. Unless a sufficient corrective force acts upon the strain to free it up, it will persist. Perhaps you're wondering why interosseous strains matter. Well, one, force will not move through the strained area of bone as it should. Sometimes people feel this. I've had many patients come in complaining of heel or shin pain when walking when there is an interosseous strain present, and the pain resolves once the strain is corrected. It could also make them more prone to stress fractures in that area. 2. Bones are piezoelectric. This means they convert mechanical energy, aka force, into electrical energy. They also conduct charge. So every time bone has a force move through it, charge is created and conducted across the bone. Cells within bone and the surrounding tissues respond to this charge. Their optimal health depends upon it. And 3, the position of bones alters ligamentous tension at joints, affecting proprioception and altering coordinated muscle contraction. Interosseous strains that even slightly alter how a bone is held at one or more joints create a kind of proprioceptive noise that interferes with the nervous system's ability to optimally guide complex coordinated tasks. The tibia is a good bone to learn to feel interosseous strains on. Many a person has bumped their shin against something, like a shopping cart, or landed wrong when jumping off of something. Apply a compressive force onto the bone and get a sense for the compressibility or springiness of the bone. Compare how each tibia accommodates your force. Odds are you'll notice a difference between the two. An interosseous strain feels more dense. It lacks healthy compressibility. The abnormal density in the bone alerts us to the strain, but for treatment we will need to motion test for the direction of ease. One way to treat an interosseous strain is with what I call balanced osseous tension. It's like balanced ligamentous tension, but instead of ligaments, we're balancing bone. So it's an indirect technique, but while balanced ligamentous tension balances across a joint, balanced osseous tension balances across the strain within the bone to normalize the tension at the strain. This is accomplished by applying forces to the bone, usually just adjacent to the strained bone tissue. Apply the force in a way that pushes the strain in the directions it wants to be in, and then just barely exaggerate it. Not a lot of force or motion is required. This technique should not hurt, and with sufficient practice, this technique corrects most interosseous strains in a few seconds. This left tibia has a strain distally. For you, the viewer, I'll demonstrate the ease of motion directions for the adjacent parts by lifting my hands off before treating. Notice how the motions are opposite of each other, just like with BLT. Then I put my hands on, press with enough force to exaggerate the bone, and move the parts to a point of bounce. Slight exaggeration and the strained bone corrects itself. The area should no longer feel like granite. I have made this video as a resource for other physicians and body workers. Do not attempt to perform any manual techniques unless you are a physician or body worker or a student under proper supervision.